Can you hear me? Oh, there we go.
Can you hear me?
Hi there. How's it going?
Good. How are you?
I'm hanging in there.
Okay. So what's up? I see that you saw Dr. Danielle and he put you on the Subutex. How is that going?
Yeah, it's going all right. He just put me on a pretty low dose, and then he left on vacation for a month, so he'll be gone for a couple more weeks.
Okay. So do you know when he will be back?
Oh, I believe.
Or have you scheduled with him a follow-up?
Yeah, they should. Let me double check. Yeah, I'm pretty sure I have a follow up on here.
Okay.
Or at least I know we talked to his office about it. Let me double check. But it should be around like. Oh, yeah, it should be within the next week or so. I'll have to give him a call today.
Okay. And the nurse was telling me about the suicidal ideation you're having daily. Is this something that's been going on or this is recent?
Wait, you're kidding, right? I tell you guys this at every appointment. I've said this at every single appointment that I've ever had with you guys.
Okay. I know one of the, when you talk about the last time I saw you, that's what, then I talked to Georgia for us to get you back on that buprenorphine because mostly you're suicidal. You say you don't plan to harm yourself, but you sometimes you eat so much pain, you just want to end it.
Oh yeah, no, I constantly have passive suicidal thoughts. Yeah, the physical pain is yeah, absolutely, it's getting too much to bear. I can't even like hide it anymore. It's like all over my face. It's been difficult to contend with. Yeah, I've said this at every single appointment. I've been pleading with you guys.
But it was mostly pain because you were in so much pain.
Precisely. Yeah.
So we try to kind of find a way to help, and because of the past history too, where they put a pain pump in and things went wrong. So that's why I wanted to talk to Georgia to see, he been talking about suicidal ideation due to the pain because he hurt so much. So we need to, who was saying, because there were no information with Dr. Pilkers in your chat. So in Georgia, remember, and that's how we reach out to Pilkers, and then I send you to Dr. Danielle.
I don't know how.
When you started on a low dose of the Subutex, you just said.
But that's simply, I mean, with all due respect, that's impossible because when I met Dr. Pilkis, that was like when I was really at a height of that state, when I was in like drug withdrawal from the pump. Every single doctor appointment that I've had, I've made it very clear that I have been suicidal and that I need to do something. And I've been here for over a year now, and the only thing that we've been able to do besides having this appointment once a month is we got the Emgality. And I've had 2 doses of it in the year. We haven't gotten to do any of these modalities that everybody's talked about. Like, we haven't done anything else. And it worries me a lot that you don't know that this suicidal ideation was already a thing, because I've been talking about this every single time, and I've literally been pleading with you guys using analogies, metaphors, straight up word, like everything I can conceptualize to make my doctors understand that I'm not in good health and that this is really troubling, and I can't take the physical pain. I'm happy to do emotional work on myself, which I do constantly. I'm happy I do physical therapy every single day. I go swimming every single day. My situation, I'm not here for a lack of trying, but I'm starting to get really frustrated because we've seen each other for a year now, and I haven't even had an appointment with any other type of physician except for that one appointment with Dr. Darnell.
Mm-hmm. So that, let me go back here because we do document our conversation. So my next question to you is, have you
I know.
actively seen a psychiatry?
Is Georgia not a pain psychologist?
No, a psychiatry.
Like a person that, I mean, my primary doctor is the one that prescribes the majority of the antidepressants and things like that. And then
Okay.
Georgia provides the therapy, like for pain psychology.
Okay, Georgia is pain psychology.
That's what I just said. Yeah.
Yeah.
Yep.
And then a psychiatry, especially because the last time I just went back, patients said that due to pain, he sometimes have suicidal ideation. States that if friends told him to continue to complain about this, maybe someone will listen. That was 11/6/24. Okay, and that's when I talked to Georgia. I said, and because too of your restricted recipient documentation that is on your chart, we have to follow through. And that's when I also reached out, and this the guy that taking care of this, what's his name again? Andrew. Mm-hmm. Also, when I tried to prescribe the buprenorphine, and then I end up with a roadblock, and I said, okay, maybe if I send him to Dr. Danielle to see, because he's addiction medicine, and if I even start, and I had all this conversation with you, and it's also documented. So what, especially when someone is having a suicidal ideation, what you say is daily, because from my conversation with you, usually it's like the pain is just unbearable. Mm-hmm. And which makes sense. I've heard patients say that I'm in so much pain, sometimes I just want to do something to get out of it. That is different than when you're having a suicidal ideation based on mental health. So that's two things we're talking about here.
But that's not. I'm asking. Yeah, this is not based on mental health. This is entirely based in, we're talking about physical pain. And make no mistake, I've had over 18 years to understand where the separation, that line is between my physical pain and the physical structures of my body. Like it's the scoliosis, it's the nerve damage, it's a lot of things. I recognize that emotional problems also affect those same neural pathways, but I do work on that on the daily, and I have for years. Like this has been a problem. I came to Anoka Riverway because Dr. Pilkus sent me there, and I was told that
Georgia. Yeah.
I was told that we were going to have a whole bunch of other different options, and we just, I guess I'm not understanding like where the confusion is, because I've taken notes on all this stuff. Like we've had the same conversation over and over again. I just want to figure out a way forward. I understand it's difficult dealing with Andrew, the care coordinator for HealthPartners, but it's necessary. And I am having so much miscommunication and just lack of communication in general. And I'm trying to convey to you guys in the most gentle way that there are lives in the balance, my life in the balance. And every time we have a meeting like this and things don't happen, another month goes by and I'm still in the same situation. And I just don't know, is there anything else that we can do besides taking Emgality within the care of the Anoka Riverway Clinic?
The Emgality is for your migraine headache.
So what can we do for pain? Why haven't we done anything for pain yet?
What do you mean? We haven't
We
done anything for pain.
we haven't done anything. In a year and however many months, the only thing that has happened between you and I is I've gotten the emgality.
Okay. So let's get some clarification here. Your situation is a little unique. When we prescribe medication, I think I prescribe an naltrexone for you, and you attest to how many prior of what all the complication we went through for them to approve it. I think you can attest to that. So it's not only emgality. And the emgality, you know how many hoops we have to jump. So it's not like, and that's why I say your situation is a little different, because I don't know the insurance part. I can't attest for insurance. I don't know how
But
it
that's
works.
your
I
guys'
will only
job.
put in order, and then they will say, no, we deny, you got to do this, we got to do that. And I think you can attest to that, right? So it's not only emgality. It would try and attract some.
But that's not an excuse though. I understand that my insurance is hard to navigate, but that's not all. I do what I can. That's not my job. You guys have a support team on your staff to handle these things. I understand that I need to be my own advocate and move this forward, but I've been banging this drum forever and nothing's moving forward. And you guys are the professionals. We come to you as patients to help us navigate this.
But we are
And you're
insurance.
hold on. You're telling me what you're
That's
telling. You're just telling me that my insurance is simply too hard to suggest or try anything else.
I said, when I put in the order for naltrexone, did you get it right away?
Did I get it right away?
Because usually when I put it in for patient.
No, I had to fight for the naltrexone forever.
They charge $30. Some people can't afford it, so we go to something else.
I had to fight. I fought for the naltrexone and finally got it, and I didn't get it right away. It took weeks and weeks.
No, you didn't. That's what I'm saying. It's not something we put the order in. It left for the insurance to pay for it. That is out of my control. We don't have staff to talk to the insurance to say this person deserves it or what's going on with this person. When they tell us that we need to do this, we will do it. We did prior off for you. We did everything we could. And finally, they agreed. And I didn't know that when you have either Minnesota care or you care, it is so different that I don't know, to be honest with you. I'm not going to sit here and tell you I know how insurance works, because everyone has different insurance.
I understand that, but you guys do have a team of people there. There are people dedicated, there's a whole department dedicated to simply referrals. I'm hearing a lot of excuses about how things are just too hard for me on your end.
We don't have control over insurance. You have to make sure your insurance will I want to repeat it again.
So you prescribe something and you wash your hands.
We don't have staff to call your insurance and say, is this person qualified or this person done? It's the patient responsibility. We don't have that. So let me clarify that. So if we have issue, if they say we should do prior off, we do the paperwork.
I know these people are on your payroll. With all due respect, you have staff that does this.
No.
What does Audrey do there?
What do we do here?
What does Audrey do there?
Audrey is a medical assistant. When we send a prescription in, Audrey doesn't know your insurance. When we send a prescription into pharmacy send your prescription to the insurance. The insurance, the one that pay, will agree or approve your medication before you get it. When we send it in, and pharmacists send that information to the insurance, and insurance said, no, we're not going to cover, but you need to fill out this paperwork. That's what we do. We don't know what your insurance cover. We don't know what they pay for. We only send in the prescription, and that's where I am the middleman between the pharmacy and our clinic. I send in the prescription. So to be honest, I'm not going to sit there and tell you, say, we know each individual insurance or how it works. The process is we send the prescription in pharmacy to pharmacy. Pharmacy send it to the insurance. When insurance approve it, then you get it. And I have no clue that pipeline, how it works. And we don't have staff here to do that. We just got an email from our supervisor stating that because patient has been calling Audrey to check in the insurance, whether they can get this, they get that. That part we don't do. They say we shouldn't because it will create confusion and it will create more problem.
But that's not even true. They call me, you guys call me, and I call Andrew. Like, that doesn't make any sense. Okay, so we'll just be done with that because that's the past. Is there anything else? What do we do at your pain clinic? What other options are there besides Emgality?
Okay. So we prescribe medical. We don't prescribe narcotics here.
Yep. Okay. Yep. So what other modalities do you guys have?
We get you off. We don't initiate. We prescribe medication like Lyrica.
Yep. I've taken that stuff for years and years. What I'm asking is...
I know. I've seen that here. And we talk about it, and you say you've been on it, and it didn't work. So what else
I'm still on those prescriptions. I have been for many years. I was referred to you by some of your associates because I was told that you guys had a different way of doing things, that you had other therapies, you had all kinds of stuff, occupational, physical, that you had different disciplines, that there were other options, and that you also did spinal injections and things like that.
No, we don't. So that was a wrong information. We refer.
Okay. Okay, so but you guys seem to refer.
Let me answer it now because we're going back and forth. Let me answer. When you ask me a question, I will answer it. The first time I met you, I told you what we do. We provide multidisciplinary option here. So we do medication like what I just listed. Mm-hmm. We have a pain psychology and physical therapy, restorative physical therapy. If a patient need any other intervention like doing injection, or if we need to order spine, MRI for your spine, if you're having issue with your spine and this medication not working, then we send you to neurosurgery.
So let me get this straight.
To kind of come up with a final diagnosis. If they need to do injection or you need surgery, that department will take care of it.
So let me get this straight. You guys don't do anything else there then? All I've heard is that you just refer people out to these other places.
Yes, we don't do it here.
So then what do you do?
Yeah.
Okay, then what do you do at the pain clinic? And I'm not being snarky. I'm asking, if you refer all these things out, what is it that you do at Anoka Riverway in clinic?
I'm going to repeat it again.
You do psychology? Yep,
you asked me, you're not waiting for me to answer.
I just let you answer.
Back and forth.
No, I've recorded all these things. I give you plenty of time. I make sure to give you time to answer.
I'm glad you're recording.
We sputter through this.
Can you give me a chance so we
Sure, yes ma'am, go ahead.
We prescribe medications. We don't prescribe. If you're on opioids, we safely get you off. We taper patient off. We have restorative physical therapy and a pain psychology. If you need any other intervention, invasive procedure, we refer you. If your knee is bothering you, for example, and you're doing physical therapy and we're not getting any benefit, I will refer you to an orthopedic doctor. If your back is bothering you, maybe let's just say your lower back is bothering you, we have done medication like gabapentin, Cymbalta.
But you guys didn't prescribe me any of those things. I've been on that for years.
You asking me, you recording, right?
Yeah, and I'm
so you can't allow me to explain because you keep asking me what we do, but you're not allowing me to explain. And I can't tell you otherwise. I'm not going to make up a story.
I'm
I'm going
giving
to
you
tell you
plenty of
what I've been
time.
doing for the past 10 years that I've been here. I work in inpatient orthopedic pain, and this is 10 years that I work in this clinic. So I'm telling you now what we do. Maybe you did, because the first time we meet, we give patients a lot of information. Sometimes it's just too much for them to take in.
No.
I have been seeing you over a year, I think was it 2023?
Mm-hmm.
And we did talk about what we do here.
And
So
that's my point. Since then, we've had
today,
emgality, and that's it. You say multidisciplinary.
I prescribe Naproxen for you. It's a central nervous system.
I understand what it is. These drugs.
You were complaining about migraine headaches that has been bothering you for years. We have ordered that medication for you. We had a little bit of problem with it.
I got to take it twice in a year and a half. I got to take it twice. I'm telling you, there's no follow through. I'm being referred
I am sorry. This is what we do. If you need extra or additional medication, I will prescribe you on some. I add some.
Okay,
to it.
so I understand that.
I refer you to addiction medicine.
I know you.
Something.
I know you've got a flow chart.
What else you want from me?
Okay, I want you to actually just look at my personalized situation. Okay, so I listened to you. Now give me just a moment. I want you to look at my situation. You're talking about all these medicines that I've already been on for years, that my primary doc has been prescribing for years. The PT aspect, already been doing all that for a while. Same with like the pain psychology and everything else. So there wasn't really anything else. You sold me a multidisciplinary approach when we met after you looked over my file. But there wasn't anything left for me there, was there? Because I was just going to be referred out to these other disciplines at other clinics.
You done?
Yep.
You done? You want me to respond? Because
Yeah.
I don't want us to, when going back and forth, there will be a misinterpretation. This is what we do for the past 10 years of this clinic. That's what we do. You said someone told you we do injection here. I said, no, we don't. We refer patient. Okay? We treat patient with chronic pain. And we treat your symptoms. You have headaches, we try to find something that will help with the headaches. I order a medication that I hope that we're going to help. But every step along the way, there was issue with your insurance, so you didn't get this medication on time, but you started using them. If you're expecting something else, I want you to tell me, and then I will tell you whether we do that here or not.
Mm-hmm. Well, nobody's even addressed the main reason I went there in the first place. For my thoracic pain, like it's specifically within a couple of vertebrae. And I'm happy to work on these other side things, but we haven't even gotten at the root of things. And the medications that I did get, like, I'm just confused. These are all things that my primary doctor already does or did. And so I don't understand the benefit. Like, I don't know why Dr. Pilkis.
So who refer you here?
Dr. Pilkis?
Dr. Pilkis?
Yeah, and I trust her, like, with my life. She's a great doctor. But you and I...
We refer you to see Dr. Pinopolis. And before you see Dr. Pinopolis, you have to see one of the medical staff.
Mm-hmm.
And I think, I saw you the first time I saw you was November 30, 2023.
I guess, yeah, expectations were completely different. I thought that I did not expect that you would do any opioid therapy whatsoever.
No. And you told me that. You were saying you try physical therapy, you try OT, and you try...
Not just try, I've been in it. I'm even, like, in physical therapy right now. Like,
Yep. And this is the first time I saw you. I'm just going through... You have taken gabapentin, Lyrica. None of these medication help. Ketamine prescribed by a psychiatrist helps a lot, but insurance deny. That was 11/30/2023. Okay.
When was our first appointment?
I said November 30, 2023.
Oh, I'm saying that's our first initial appointment?
That's exactly.
Okay.
Exactly. And you had, let me see here, you had MRI of your spine. That was 7/8/2021. And the result is here. Overall, no significant change in mortal level degenerative finding in the lumbar spine.
Mm-hmm.
That's the result. That's in your chart.
Mm-hmm.
Yeah.
Yeah.
So, I think I have spoken to you about you seeing a spine specialist. So I'm going back.
Mm-hmm.
The next time I saw you was February 13, 2024. Let's see here. That's when I prescribed naltrexone.
Mm-hmm.
He has not picked up the naltrexone due to insurance reason. It's right in here.
Mm-hmm.
Okay.
Yeah, and then I fought for that for a few weeks.
He is not allowed to pay in cash for the medication. He need approval from his insurance.
They let me pay cash for that one.
Restricted recipient. So that's where we started with the problem. And then we call and said, this is not narcotics. Mm-hmm. Why will you restrict him? And they said they can't cover it. You have to pay out of cash. And we call you.
But I can't pay cash because I'm on there's like a lot of
Yeah. So everything is documented here. They will call you. Okay.
Yeah, this is a surprise.
The patient is on a restricted recipient list. He is not allowed to pay in cash. Mm-hmm. We need insurance to approve. And we call Andrew and we keep going back and forth that this is not narcotics. They can't restrict you. And at one point we asked you if you can pay out of pocket. That was the naltrexone. This was February 2024. So you're saying that we haven't done anything for you.
No, I didn't say that at all.
Well, and I'm glad we document all these things. So
I didn't say you didn't do anything. I'm just saying things got hard because of my insurance, and then you told me basically like that you kind of wipe your hands of it.
You have to go look into your insurance. We don't do insurance.
Yep, I don't know why we're still talking about that.
Tell us what we need to do, then we do it for you. It's the same thing with the Emgality. So what do you want from me? Because
I think I'd like to transfer care to another doctor, or either that or leave the clinic.
Yes, okay. I will refer you to my colleague, which is Dr. McDonald. So I'm going to do that right away.
And he works in the same clinic?
Yep.
Okay.
Yep. All right. So we get that. And do you have your Emgality, or do you want me to reorder? Because I see reorder here.
Yeah, I'm sure I'll need a reorder. Yeah, I've only gotten the one. And yeah, I just got an email today saying that I actually need to refill that.
Okay. Is it a CVS specialty pharmacy?
Mm-hmm. Yep, that's right.
Okay. So I send this over, and I'm going to refer you to see Dr. McDonald. Okay.
All right.
It was nice working with you. Maybe she will be able to help you better.
Okay. Thank you. I appreciate it. Yeah. You take care.
You're welcome. Have a good day.
You too. Damn. Everything I thought it'd be an end more.